Hi, I'm Kevin Sowers, President of the Johns Hopkins Health System and Executive Vice President of Johns Hopkins Medicine. Today's installment of the COVID Leadership Dialogue series will focus on what we're calling the Rejuvenation. We've experienced so many challenges in 2020 and to this point. And now we're optimistic that we've turned the tide here, turned the tide with the pandemic, and people are starting to return to the classrooms and to the workplace. Our world is starting to open back up little by little, but there needs to be some sort of acknowledgement of what we've been through as a society and as an organization, and a commitment to mindfully creating opportunities for rest and rejuvenation. And today I'm here with Johns Hopkins Medicine's Chief Wellness Officer, Dr. Lee Biddison, who leads our Office of Wellbeing. And we're going to talk about how members of the Johns Hopkins Medicine team are doing and about how we can build resilience as a part of an organizational period of rejuvenation. Dr. Biddison, how are you today?
Hi, great. Great to be with you too.
I'm glad you're here, and I want to begin by thanking you and the entire team for all the incredible work that you've done. And I want to also congratulate you and your team for being selected by the Maryland Daily Record as a healthcare hero for the work you've done and continue to do to support our staff through 2020 and beyond. Congratulations.
Thank you so much.
So, I've spent part of the last year rounding on all of our units, and at many points, I was concerned about the resilience of our healthcare workforce, our faculty, our staff, our community physicians, because last year was so layered. There was the pandemic. There began a movement to address social injustices. There was a nation divided by political ideologies. There was the isolation of quarantine, the financial impact families were feeling due to businesses closing, people losing their jobs. Schedules were disrupted due to schools and business closings. I think, to put it mildly, it's been a rough year. What sorts of problems were you and your team hearing at the start of the pandemic?
A year ago when this all started, the challenges that we heard about were very practical, many of them. Everybody jokes about the toilet paper issues, but there were people who couldn't find toilet paper. There were people who they were working such long hours they couldn't make it to the grocery store to pick up basics for their families, for their children. There were lots of struggles with childcare and education, with very, very practical needs and practical challenges.
Now we're still dealing with some of the same problems we were facing last year, but I think we both would agree that we've certainly turned a corner with mass vaccination and all the other efforts that's taken place around social distancing, masking, and washing of hands. What sorts of challenges are you hearing from our physicians and staff in this moment?
It's a great question. It's really struck all of us as we are doing this work, and how the needs and the experiences change over time. I mentioned the practical needs we saw before. There were also certainly safety needs, and those shifted with mass vaccination and with our growing comfort with PPE. I think, the predominant emotion that we hear and experience that we hear now is fatigue. People are tired. We have an extraordinary team. And people have brought their best month after month after month. And as we've rolled into another year, I think there is just an overwhelming sense of a need for rest and a feeling of fatigue.
Yeah, the other thing, Lee, that I just wanted you to speak to for just a minute is, as I've rounded and people have gone through a year of caring for COVID patients, I also see the moral distress that people have experienced from watching some of their patients die and not having their loved ones at the bedside. And, that goes against everything you were taught as a doctor and I was taught as a nurse about patient and family-centered care. Talk to me a little bit about that and how you and the team have seen it and responded to it.
So great question. It is extraordinarily stressful to be in a situation where you are watching patients, despite the very best care and the very best management that we can give them, suffering. And part of their suffering is not just physical, but emotional and being separated. being separated from those they love. The experience of many colleagues caring for particularly our critical care patients, or the ones that I know best as an ICU doctor, is being our providers, or being the conduit, the connection between families and the loved ones. By either, it could be anything from taking the iPad into the room so that a family member can FaceTime with their loved one, or it can be the daily updates, which are a privilege, but also are intense. It is a very intense experience to be that soul link. And so it is absolutely true that a large degree of the experience, especially for those who have been, not exclusively, but especially for those who've been in COVID care, doing COVID care for the last year, are stressed by that.
One of the things that's striking to me as I listen to you is it's one of those moments where people have had their professional turmoil and experience, and they're tired, there's been moral distress, and then layer on top of that the personal experiences that people have lived. And I agree with you, people are tired. I know many of my colleagues that are tired. While every person here has had different experiences over the last year, it has become trying time for even the most seasoned among us. I know, in the midst of this, one of the things I acknowledged, Lee, was when someone goes up against this much constant stress, you can't help, your body can only take so much, and you start to experience anxiety and depression. And I know how hard it is for our providers to talk about that, but can you talk about what experiencing periods of stress does to people over time and to our organizations?
You mentioned anxiety and depression, and those are certainly more prevalent than they've ever been in the general population and in amongst our team. Burnout is another big component of what we're experiencing. And burnout is this phenomenon that has gotten a lot of press probably over the last decade, especially in healthcare, but it is this syndrome of depersonalization and emotional exhaustion, as well as a sense of lack of efficacy in work. And so what we see, or what we can see, is that there is much more difficulty connecting in meaningful ways, not just on the job with patients or colleagues, but also at home with families. We can certainly see that. We objectify our patients or issues and situations rather than engaging them as individuals and as persons. And we know these things are associated with worse outcomes, can be associated with increased medical errors, which is something obviously we're working hard to avoid at all costs. So it's something we want to pay a lot of attention to and think about addressing proactively as we move forward.
Lee, one of the things I also worry about, and we all know this as healthcare professionals, but anxiety and depression can also lead to poor strategies for coping in terms of substance use, alcoholism. And so another good reason to, number one, acknowledge that you're struggling, and number two, asking for help so that you can have more effective ways of coping with what you're going through. And so I would encourage staff to think about that. So we've been talking through some ideas of how to create this sort of time period to rejuvenate, so that people understand that it's okay to rest and to take care of themselves. Talk to me a little bit about some of the ideas that people could do at the individual level to support personal rejuvenation, and what about their families? And families can be blood relatives or whoever you bring into your circle of family.
On an individual level, I think one of the things that's important is to think consciously and plan for rest. You mentioned that rest is okay. I take it a step further and say rest is not just okay, it's essential. It's part of being a whole person, and we want to not just give permission, but actually proactively encourage to the degree that we can do that. We work with teams of very motivated, very productive individuals. And sometimes it's hard. I know that feeling myself. That someone accused me once who said, "You have to be exhausted to feel comfortable." And I said, maybe that's something to think about, and just to stop and say, I'm going to be intentional about the rest that allows me to connect with my family and with my loved ones. That might be spending specific time on weekends or spending time in the evenings over meals, planning activities together rather than just sedentary space. So games, certainly, walks and hikes, all those things can be restorative and can be things that folks can engage with their families, their loved ones, that can really make a difference.
Lee, the other thing I realize is that when people become really tired and exhausted, experiencing anxiety and depression, it's also real easy to focus on the negative. And the other thing I'd encourage folks to do is when you go home at night, it's often easier to focus on the things that went wrong than the things that went right. And I learned a long time ago that before you go to sleep, to think about the 3 good things that gratitude practices are incredibly important. And Brian Sexton's work, when I was at Duke with him, he did incredible work with staff around making sure that we focused on 3 good things, and gratitude made an incredible difference on how people feel about themselves. So I would also encourage people to do that. Your office has worked hard to create an infrastructure to make it easy for members of the Johns Hopkins Medicine team to access resources related to health and wellness. I know there are resources focused on resilience, nutrition, exercise, financial well-being, to help people of JHM navigate any challenges in life. Can you tell us how they can access these resources?
Certainly. The easiest thing to do is to go straight to our Office of Wellbeing website, and that is accessible from all of the clinical workstations. And it's just by Googling, if that's the easiest, most common way for people to find things, Johns Hopkins Office of Wellbeing. And there are links to all of the different resources that you mentioned.
Well, Dr. Biddison, thank you for joining me on this important discussion. And thanks to you and your team, because your team has done an incredible job and will continue to do that to support all of the people within Johns Hopkins Medicine. So thank you for being with me today.
Thank you so much.